Отже, зараз рівно 5 година. Усім доброго вечора. Мене звати Аркадій Водяник, я спеціаліст з інфекційного контролю і антимікробної резистентності Бюро Всесвітньої організації охорони здоров'я в Україні. І я дуже радий вітати вас на черговому вебінарі онлайн-курсу, який називається «Антибіотикорезистентність. Від знань до дії». І сьогодні ми поговоримо і, власне, відкриємо новий модуль у даному онлайн-курсі і будемо говорити про антибіотикорезистентність як загрозу глобальному здоров'ю. Сьогодні нашим спікером є доктор Кетеван, технічний спеціаліст з питань антимікробної резистентності регіонального офісу Всесвітньої організації охорони здоров'я Копенгаген. Перед тим, як ми перейдемо, власне, до самої презентації, декілька таких організаційних моментів. Сьогодні презентація буде відбуватися англійською мовою, і для того, щоб ви могли скористатися українським перекладом, вам треба знайти внизу екрану значок, який виглядає як глобус і підписаний Interpretation, натиснути на нього, обрати напис Russian і потім натиснути внизу кнопку Mute Original Audio. І це дозволить вам чути український переклад і, власне, не чути англійську мову. Тому, ще раз повторюю, ви маєте знайти глобус, натиснути на нього, знайти Russian і натиснути Mute Original Audio. Також хотів зазначити, що презентація сьогодні буде тривати приблизно 50 хвилин. У нас буде 10-15 хвилин, щоб відповісти на усі ваші запитання. І для того, щоб задати запитання, ви можете написати їх у чат, або в загальний чат, або скористаючись функцією Q&A. У вас є такий значок внизу. І на усі запитання ми відповімо наприкінці вебінару. Ще раз хотілося б нагадати, що це вже 7-й вебінар у онлайн-курсі «Антибіотикорезистентність. Від знань до дії», який спільно реалізується неурядовою організацією Medical Gate, Всесвітньої організації охорони здоров'я за фінансової підтримки Європейського Союзу. І попередні 6 вебінарів, які стосувалися аспектів клінічної мікробіології і клінічної фармакології, ви можете знайти у записі на Фейсбук-сторінці Medical Gate. Тому запрошуємо вас ознайомитися з попередніми вебінарами. І, власне, цей вебінар, він відкриває новий 3-й модуль, і протягом вересня місяця у нас заплановані ще 2 вебінари, які будуть стосуватися раціонального використання антимікробних препаратів і організації заходів інфекційного контролю для попередження поширення антимікробних резистентних мікроорганізмів. Але наразі розпочнемо з таких глобальних аспектів і впливу антимікробної резистентності на глобальне здоров'я, громадське здоров'я. І на цьому передаю слово Кеті. І через 50 хвилин ми знову зустрінемося і будемо відповідати на ваші запитання і гарного прослуховування. Кеті?
Thank you, Arkady. Good afternoon, everyone. My name is Ketevan Kandelaki, and I'm technical officer at the WHO Regional Office for Europe, working on the aspects of antimicrobial resistance and in particular the areas covered by governance and stewardship. I'm very pleased to be here today and to present some of the updates, global and regional updates on the AMR from the WHO perspective. As we all know, that antimicrobial resistance is a global issue, and it occurs when the microorganisms such as bacteria, viruses, parasites change and they don't respond to the antimicrobial drugs that have been previously effective to treat those infections. And we have seen that during the ongoing COVID-19 pandemic, with the indiscriminate use of antibiotics, particularly the issue of antimicrobial resistance has become even bigger concern. Antimicrobial resistance claims lives, and I would like to present the report that OECD has published just before the start of the pandemic. And please keep in mind that some of the numbers and the estimates that have been presented in this report surely are changed now with the impacts of the COVID-19. But even back then, it has estimated that about 2.4 million deaths will occur due to antimicrobial resistance between 2015 and 2050. And it costs billions, $3.5 billion a year. However, there are actions and there are solutions that can turn this situation around. WHO has developed the Global Action Plan in 2015, and it has 5 objectives, and the 5-pronged assaults to AMR have been identified that are very much linked and could address those 5 objectives of the Global Action Plan, and those include promoting better hygiene, ending the overprescription of the antibiotics, and also promoting the rapid testing to distinguish the viral from bacterial infections, so the treatments provided to the patients are adequate and relevant. Also, some practices such as delaying in prescribing to ensure that there is no overprescription of the antibiotics and unnecessary use of antibiotics. And of course, the mass media campaigns that will raise the awareness both in healthcare providers and also among the public about rational use of the antibiotics. The report has also highlighted that 3 out of 4 deaths that is currently attributable to the MR could be averted by spending about $2 per person per year on the simple measures such as hand hygiene and more prudent prescription of the antibiotics. For this, since 2011 and way before the Global Action Plan was developed, European Strategic Action Plan that was developed by the WHO Regional Office for Europe was recognized by all 53 member states, and it also recognized that the AMR is a neglected topic in many countries. The lack of surveillance systems provides foundation to lack of strategies and directions of the actions of the AMR battle, and also there's a need for the intersectoral coordination. The need for international stand and data sharing. We have seen that through the pandemic, the importance of the international data, and this also applies to the antimicrobial resistance. Since this regional strategic has come to the end in 2020, but its objectives are still very much relevant. For 2022, we will be developing a new roadmap how to implement the national action plans that have been developed upon the call of the Global Action Plan since 2015. For this, also the global monitoring has been taking place. It started in 2016 with a collaboration of FAO, OIE, and WHO. And globally, countries are asked to fill out the questionnaires every year, and there has been 5 rounds by now. However, the data of the 5th round yet to be analyzed and to become publicly available. But the data from the 4th global reporting is available on the WHO website. And you can see that 70% of all the member states of the WHO, all regions have responded. And in WHO European region, we have 96% of countries responding to the questionnaire. You can also, through this channel and website, go and select different years and compare the countries, compare the regions, compare the questions, and see the progress of each country, including the Ukraine, how it has been progressing across the years when it comes to the objectives and the questions addressing the antimicrobial resistance. For example, this is the data from 2017 questionnaire. Global map can be generated. One can also look at the different questions, such as multi-sectoral and One Health collaborations in the countries. Also look at the national surveillance systems available in the human health, progress on strengthening veterinary services in the countries, and different questions on the different levels, some sort of traffic light system. And one can also see progress on the development of the national action plans. This is, for example, an overview how the countries can be selected individually, and it can be also selected according to the regions. Main drivers of AMR remain well known, that it's unnecessary prescription of antibiotics, inappropriate prescription in terms of using broad spectrum antibiotics where narrow spectrum could have been preferable, wrong duration of the treatment, dosage, and route of administration. Oftentimes also no testing to support the diagnosis of the pathogen, and oftentimes also the self-medication due to over-the-counter availability and the sales of the antibiotics in the countries. WHO supports certain activities and trainings in different aspects to address various aspects of the drivers of the antimicrobial resistance. We're supporting standardized laboratory methods, data management analysis, antimicrobial stewardship program establishments in the health facilities, infection prevention and control measures, also behavior and cultural insight campaigns and research. evidence proof of policy developments that has been supported by EVIPNet, which is a separate unit in the WHO regional office, and supports the development of policies that leads usually to the policy dialogues and strengthening of various aspects of the AMR that individual countries identify to be relevant for their setting. As FAO, OIE, and WHO One Health policy, it has been long recognized that AMR is one health issue and it goes beyond human health. So earlier this year, we have also established a platform for the coordinating efforts of tripartite. We also support research projects and, of course, the surveillance networks and their activities. Surveillance both when it comes to antimicrobial consumption and use, and also antimicrobial resistance. In terms of expanding the surveillance throughout the European region, the countries of European Union have been long submitting the data on antimicrobial resistance to the network called PIRSNet. And you can see also through the ECDC platform, the changes of the resistance patterns in the countries. And later on, since the 2012, the Central Asian and European network on the surveillance of antimicrobial resistance have been established to have introduced the competitive methodology for the surveillance of antimicrobial resistance, and to have generated the surveillance data for the whole European region. And every year in November, during the World Antimicrobial Awareness Week, the reports are published to show the data submitted by the member states. Last year, we have been discussing of generating the joint report with ECDC. However, due to pandemic, this has been slightly delayed, the progress of the joint report. However, in November this year, there will be a summary report generated as a joint report, summary report of the data submitted from EU and non-EU member states of the European region. And for 2022, next year, we expect to publish a full report on the European surveillance of antimicrobial resistance. That will give a possibility to look across the whole region and individual countries also closely. Generally, there are challenges when it comes to surveillance, and oftentimes it is linked to challenges linked to the sampling frequency, blood samples, urine samples, etc. If the microbiologists don't receive the samples to be analyzed, of course, it makes it difficult to generate the data on the antimicrobial resistance. It's also linked to the treatment failures, and oftentimes in the countries where there's availability of antibiotics without a prescription regulations, patients come to the clinics with already conducted treatment course, so it's difficult to culture from the sampled cultures. There's also a laboratory capacity limitations. There's limitations when it comes to paper-based records, information systems, laboratory information systems. Also availability of the consumables for the microbiologists to analyze the received samples. For this, WHO has developed a stepwise proof of principle protocol that's looking at the routine diagnostic measures and how those measures can be applied to practice the diagnostic practices and as a part of the patient care, routine patient care. And through this protocol and through this project, pilot projects have been supported in the region, where in the country 3 to 5 hospitals are selected. The so-called POP support team is established. WHO provides the training on the sampling, provides the clear directions on which patients should be included in the project, also provides the training to the microbiologist for analysis, conduction of the analysis, and then the reporting and evaluation and the feedback back to the clinicians, and also to the network of the CSER to submit the data. These are the basic steps of the part of the project POP, where clinicians are trained on the SIRS criteria and active case finding, and then the sampling of the blood is done, sent to the microbiologist for the blood culturing. It is recommended the preliminary results of gram stain are reported back to the clinicians so the clinicians can address and incorporate this information in the treatment of the patient. And once the final results are available, that also gets sent back to the clinicians for further adjustment of the treatment. It also gets sent to the reference laboratory if the reference laboratories are designated in the country for the final reporting, species identification, and antimicrobial susceptibility testing. Other activities of the CSER network and so as part of the strengthening of the national surveillance systems and reference laboratories include wet and dry lab training, quality control, introduction of the UCAST methodology that is helping to standardize the methodologies across the labs within the country and also across the region. Introduction of the HUNET, that is an application that helps to introduce and enter the microbiology data and also supports the laboratory networks with the annual network meetings that has been somewhat disrupted due to the pandemic the last 2 years. However, as part of the network meetings, since last year, we have been providing the virtual trainings through Zoom and other platforms. We also support the countries in providing the external quality assessment and the data management trainings. These are the CSER publications from the start of the 2014, and then, as mentioned, this year and starting from next year, we are expecting to have a joint report that will provide a comprehensive picture of the whole European region, the report that will be published together with the ECDC. This, for example, looking at last year's publication of CSER report 2019 data, you can find Ukraine's data also, how the level of the evidence is labeled. The CSER defines 3 levels of the evidence from A, B to C, and Ukraine, for example, last year was falling under the level B. You can also have a more close look at Chapter 6 that is particularly dedicated to the Ukraine data, surveillance setup, and the data quality assessments. The data gets segregated based on the blood and cerebrospinal fluid samples, also male, female, gender, etc. And we have seen that we have to be very cautious when interpreting the data that's submitted because oftentimes the data that is submitted to the CSER report from Ukraine, for example, is overrepresentation of the severely ill patients and also the patients that have been previously treated with antibiotics. However, it still gives a very interesting picture and the direction of the ongoing resistance traits in the country. I have already mentioned that some of the pilot projects have been conducted in the region. Proof of principle project was finalized in Georgia and Armenia and is currently ongoing in Uzbekistan. As part of the CSER network meetings that we could not conduct face-to-face, we have just 2 weeks ago, on 1st of September, have conducted a virtual consultation, which is a central activity of the CSER surveillance network, where delegates from the member states discuss the major achievements, plans for the network, and also the challenges. Besides the surveillance of the antimicrobial resistance, the WHO European region also supports the surveillance of the antimicrobial consumption and use. There has been a second report published earlier this year that looks at the data from 2014 to 2018. And also a joint article has been published with the ECDC, where the findings of the data from 2 parts of the region have shown variations in the consumption of the antimicrobial medicines. In some countries, there's a decrease in the overall consumption of antibiotics, whereas in the other countries, there has been an increase. And there's a lot of learning and lessons to be shared across the countries and across the regions on the topic. WHO has also developed a guidance document and has classified antimicrobials into 3 categories, antibiotics into 3 categories, which is called aware categorization. It's access, watch, and reserve list. And it is recommending and promoting that by 2023, all countries globally will have at least 60% of all antibiotics consumed from the access group. However, even in this case, the antibiotics are supposed to be chosen according to general principles of the stewardship, which means correct drug at the right dose, right duration, and the right route of administration. WHO also supports the infection prevention and control measures and also the surveillance of the healthcare-associated infections. Globally, we know that at any given time, at least 7% of the patients in developed and about 10% in developing countries will acquire hospital-acquired infections. These numbers have been somewhat increased during the COVID pandemic in the settings where there has been overcrowding and overload of the patients due to COVID-19. And we know that the deaths from the hospital-acquired infections occur in about 10% of all affected patients. In the European region, 1 in 18 patients in European hospitals has hospital-acquired infection at any given day, and it costs about 7 billion approximately in the direct cost. For this reason, infection prevention and control measures and practices are particularly important. And also the surveillance of the hospital-acquired infection is also of very much importance to have a very clear picture of which pathogens are circulating in the hospitals and to define the strategies and measures to address them. Effective infection prevention and control programs lead to at least 30% reduction in the hospital-acquired infections, and that also results, hand hygiene, for example, a simple practice that I have also previously mentioned, results in the reduction of at least 50% of the transmission, and establishment of the surveillance of the hospital-acquired infection further contributes to up to 57% reduction in the hospital-acquired infections, because it gives a very clear picture of what's going in, and having data available helps to monitor and implement the practices that have an impact on the transmission and generation of the hospital-acquired infections. WHO has developed certain guidance documents and tools. Those are called core components of IPC programs. These tools are available to conduct the assessment at the national level and also to conduct the assessment at the facility level. There are 8 components of the infection prevention and control guidelines. And also there are available 11 evidence-based recommendations and 3 good practices that countries can take on and get inspired. These are some of the links to the publications. In addition to the IPC core components and guidance documents, there is also a guidelines for the prevention of the surgical site infections, also the surgical prophylaxis with antibiotics, and other implementation tools that are at your disposal, available free on the WHO websites if you are interested to have a look. Antimicrobial stewardship and the competency-based approach, guided by the principles that the right antibiotic is when it's chosen as a right drug, right dose, right duration, and right route of administration. WHO Euro has developed an online course to optimize the antimicrobial use and increase the capacity and the knowledge of the clinicians who are interested to learn more about rational antibiotic prescribing. This course is available free of charge on the platform called OpenWHO. It's an antimicrobial stewardship competency-based approach. And this course is about the duration of the course. If taken continuously, it's about 8 hours. However, everybody has a possibility to take a module, come back to it, and then or retake the modules as they go. There are 14 modules, and more modules will be added as we are developing some more some more modules to the course to be added. The 5 components focus on the understanding of the patient and their clinical needs, understand the treatment options, work with the partnership with the patients to inform them on their treatment and treatment implications and the compliance needs of the treatment. Also the communication skills and how to communicate the plan and its rationale clearly to the patients and other healthcare professionals. And also it looks into the monitoring and reviews of the patient's response to the treatment. We must all be the antimicrobial stewards. Stewardship means the careful and responsible management of the natural resources. And we know that antibiotics are extremely scarce resources and very important medicines for the health. The course is available currently in multiple languages, both as audio and also as a subtitles. We have currently over 59,000 users enrolled from all over 100 countries across all WHO regions. And if at least 80% of the course is completed, the users will receive a confirmatory statement regarding the completion of the course. In addition to the online antimicrobial stewardship course, we have earlier this year published an antimicrobial stewardship interventions practical guide. This guide is a booklet, kind of a pocket book, so to say, can be printed in A5 format, and it looks at the interventions for antibiotic prescribing prior or at the time of the prescription, and then later on interventions that can take place after the prescription. And this also helps the clinicians and management interested in setting up the stewardship programs and interested in rational antibiotic use to guide their choices and principles behind the antibiotic selection practices. This course is also currently available in English and Polish languages. However, we are in the process of translating it into Russian language, and that also will become available later this year. Every year at the World Antimicrobial Awareness Week is marked between November 18 to 24th. November 18 was the foundation of the World Antimicrobial Awareness Week, as it was a day marked by European Union as a World Antibiotic Awareness Day. Since last year and also this year, our main focus will be around the theme to stop COVID-19 pandemic from becoming an antimicrobial resistance catastrophe. Related to this, we have developed various awareness-raising materials, including the AMR and COVID-19 infographic that looks at the guidance on how to use the antibiotics, focusing on that patients with mild or almost no symptoms of COVID-19 definitely don't require the treatment with antibiotics, giving the instructions against the self-medication, promoting hand hygiene, and promoting the correct diagnosis. Antimicrobial resistance, as mentioned, is 21st century is one of the greatest health concerns, and it goes beyond the human health. For this reason, once again, there's a focus of One Health that would bring together human, animal, and environmental health practitioners to promote the prudent use of antimicrobials, both in human and veterinary sector, to promote good practices, infection prevention practices, hygiene, and also to promote the banning of the antimicrobials use as a growth promoter in the veterinary sector. AMR is also very closely linked to the food safety, as foodborne pathogens are increasing threat to the food safety, and there are 5 keys to food safety: how to handle the food, how to save the food, how to clean, how to cook, how to practice the hygiene when it comes to the food, and also food being the some sort of mediator between animal health and human health. Brings again a very important component, and the actors engaged in the food safety and the food regulatory organizations and authorities play definitely a huge role in battling the antimicrobial resistance. This is very briefly the 13th European Program for Work that also focuses on the One Health, and also the outcomes and the impacts in the countries will be measured based on the 1 billion goals that has been set by WHO, and also the indicators of the SDG. SDGs and antimicrobial resistance are very much linked to each other. There are multiple SDGs that have been associated and are also threatened if the antimicrobial resistance is not handled. And the last year, late 2019 and early 2020, a new indicator on antimicrobial resistance have been added to Sustainable Development Goals. And the countries will be requested to submit the data on this indicator, which is looking at the bloodstream inspections due to the selected antimicrobial resistant organism. This indicator will also help to set up the surveillance in the countries that will directly feed into the early warning systems for the public health threats, and also will support the better planning for the preparedness and for the response measures. Going back to the World Antimicrobial Awareness Week, these are some of the examples of the infographics and Twitter tiles and social media tiles from last year's campaign that are still very much relevant, and those are available for everyone to download, to use, to disseminate in their settings, to put up as a poster, but also just to share on the social media to spread the word and to spread the information on different aspects of the AMR and also what individuals can do to address that. We have also generated short videos about using the football metaphors to communicate without the words, how to use the antibiotics, not to use it when one has viral infections, etc. This particularly was focusing on influenza, but it can also be taken into planning when addressing the other viral infections. We have also developed some advocacy materials that are also available for downloading and printing. If interested, these are the 2-pagers advocacy briefs that showcases the linkages of AMR to other areas, including COVID-19, food safety, as mentioned, behavior inside, cancer, health workforce, migration, linkages to vaccination, gender, and etc. And lastly, I would like to also present a little bit on the tailoring antimicrobial resistance programs. This is the documents that are designed on evidence-based interventions to mitigate the AMR. We know that oftentimes knowledge doesn't necessarily translate into practice. And we know that oftentimes the surveys and multiple choice surveys that generate enormously important information are not always enough to address the details of how and why certain behaviors are shaped, how we would like those behaviors to change or to actually promote. So these documents have been designed to guide the countries and research groups in the countries to identify the behavior they would like to address, they would like to promote, they would like to change, and to through this research, design the interventions that will support these objectives. The fight against antimicrobial resistance definitely benefits from better understanding of the behavioral and cultural insights and the aspects. And this is one of the 2-pagers also that come along to advocate for the behavioral and cultural insight research, and also to give a very brief understanding of what this approach entails. We have developed and published tailoring antimicrobial resistance programs quick guide that is accompanied with a series of exercises from the toolbox, and these are step-by-step practical approach designed to implement the target behavior interventions that to address the drivers of the AMR. Those documents are inspired and built on the so-called TAP manual. We are currently finalizing the manual, and that will be also available later this year. However, these are the user-friendly materials that can be picked up by research groups, institutions, academia, to look into certain behavior practices. It follows the 5 steps, assessing the, for the planning phase, assessing the available resources, available information, analyzing what we already know, prioritizing what is the behavior we would like to address, conduct the research, design to build the strategy and intervention, and then to implement and of course to evaluate. This is also a very short presentation of the, like a poster of what is described through those 5 steps, and also a summary of the quick guide document, its steps, and the linkages with the tools available in the toolbox. The approach that is defined follows the behavior change wheel model to understand the health behavior, and it looks at the capability, opportunities, and motivations. And by understanding all these aspects, we get a better information and the picture on the behavior we would like to address. There's advantages and disadvantages, and also complementary information that comes from the qualitative versus quantitative research. And oftentimes, and as part of the CAP approach, also generation of both types of data will give a better picture. In the quantitative research, we often get the numerical numbers, and the questions and the hypotheses are sort of predefined. However, in the qualitative research, it helps to get more purposive sampling, get more words and images, emotions, and it's more rich data. However, it is of course more time consuming, and researcher itself is the tool. Through the qualitative research and through the TAP approach, we promote the focus group discussions, interviews, and observations. Of course, some of those practices have been somewhat disturbed during the COVID-19. However, we also found the way through this online virtual Zoom and other platforms to have overcome the challenges and restrictions of face-to-face meetings. And of course, the quantitative surveys that always come along very handy. Focus group discussions help to assess the group dynamics, to see the hierarchy within the groups and the different players. Interviews provide opportunities to more transparent discussions and to hear more individual perspectives and experiences. And through both focus group and interviews, it helps the interviewer and the researcher to observe and conduct the initial assessment, preparing for further research and to address some knowledge gaps. We have several pilot TAP projects. Hungary is currently conducting the qualitative analysis of the Hungarian pediatric general practitioners' antibiotic prescribing capability, opportunities, motivations, and the behavior. In Kazakhstan, the TAP project is looking into the pharmacist behavior when it comes to the over-the-counter sales of the antibiotics in the capital city. In Georgia, it will be looking into identifying barriers and drivers of introducing antimicrobial stewardship programs for the antibiotic prophylaxis for surgical infections. In Greece, we are currently in an early discussion phase. However, we estimate that will be also focusing on the general practitioners' prescribing practices in the primary healthcare setting. UK has conducted the research and looked into general practitioners' prescribing practices at so-called after the hours, late shift GPs practices. And Sweden addressed the migrants' needs and conducted the research and developed the so-called onboarding package for the migrants when arriving to Sweden, and when they are introduced to a system where they cannot access the antibiotics over the counter, and they will have to follow the GP's prescribing indications and recommendations. There are other applications of the behavior inside. Ukraine has been also taking part in the survey. This is a self-reported survey, repetitive, that has been conducted since the start of the pandemic, looking at the quantitative data collection, and it looks at the duration of the last 7 days if the individuals have taken any measures in terms of prevention of COVID-19, and by this meaning use of antibiotics to prevent or to treat the COVID-19. And there are currently 33 countries in the region participating in this survey. However, this slide shows the number of the countries that is indicated now here, the data that has been analyzed, and we have seen self-reported antibiotic use in between 6 to 46% of the population, and oftentimes without having any symptoms or having been infected with COVID-19, and this again indicates the needs for close regulations of over-the-counter sales, because simply people have access to antibiotics, and this is how they purchase and store and use as a preventive measure, which we all know that doesn't necessarily prevent COVID-19, but it definitely supports the development and spread of the antimicrobial resistance. So there are many ways of applying the behavioral and cultural insight research, and we look forward to get a more comprehensive analysis from extended number of countries, and hopefully we'll be able to share by end of this year the findings of those studies. This is the overview of those countries that participate now in the survey, and between 1 to 10 rounds in each country, and as mentioned, Ukraine has also been taking part. These are some further readings and links available to the advocacy papers on the behavior insight, also the brief and the guidance documents if you will be interested to look at. Thank you very much for your attention.
Дякую, Кеті, за дуже таку комплексну презентацію, яка охоплювала як глобальний план дій по боротьбі з антимікробною резистентністю, так і ті активності, які робить регіональний офіс Бюро ВООЗ, і як вони у тому числі і впливають на Україну, і, власне, ті документи, які можуть використовувати українські лікарі, і ті люди, які задіяні у громадському здоров'ї для, власне, і оцінки впливу антимікробної резистентності і боротьби з антимікробною резистентністю. Я хотів би нагадати усім учасникам, що якщо у вас є запитання до Кеті, ви можете написати їх у чат, і ми їх зачитаємо і дамо відповідь на ці запитання. Я поки не бачу запитань у чаті, і тому задам, напевно, перше питання. Ми розуміємо, що проблема антимікробної резистентності, вона є викликом як для глобального здоров'я, так і для громадського здоров'я окремих країн, на рівні з такими хворобами і такими проблемами, наприклад, як ВІЛ-інфекція, туберкульоз, малярія. Але якщо провести паралелі, наприклад, між антимікробною резистентністю і ВІЛ-інфекцією, то є дуже велика відмінність у кількості інформації, які ми знаємо про окремі нозології, і ту кількість інформації, яку ми знаємо про проблематику антимікробної резистентності. Так, наприклад, про ВІЛ-інфекцію ми знаємо розрахункову кількість осіб, які живуть з ВІЛ-інфекцією. Кожен рік ми оцінюємо смертність від даного захворювання. І хотів запитати стосовно оцінки впливу антимікробної резистентності як на смертність, так і на фінансовий вплив. Чи є ці розрахунки наразі, чи планується проведення подальших досліджень щодо уточнення цих цифр, і чи взагалі можливо мати настільки детальну інформацію щодо тягаря антимікробної резистентності, як ми маємо для окремих інфекційних захворювань, ну і неінфекційних захворювань також? Кеті?
Sorry, Arkady, the translation did not work somehow. I can't access the globe. If you can very quickly speak in English.
Okay. Sorry, I was thinking that you have translation. So I said that there is no questions in the chat, but I would like to ask one question that we have less data on antimicrobial resistance comparing to other threats to global health, like, for example, HIV infection. So for HIV infection, we have data on prevalence, on mortality, etc. And do we have these numbers for antimicrobial resistance? And what are the plans of WHO maybe to make these numbers more precise, and if is it possible to have so much precise data as we have for non-communicable diseases and communicable diseases to understand the burden of antimicrobial resistance in principle? Over.
Yes, very good question. Thank you so much. Indeed, one of the components of the surveillance and the reasons for setting up the surveillance is to help to generate the information about the burden of the AMR. And these were the foundation of setting up the CSAR network at first place. And also right now, WHO is looking into developing a protocol that will be looking into the burden of the AMR, both from the deaths and the lost lives, and also from the financial point of view. So this is something that will be coming in the coming years, and definitely something that we will be looking into. Unfortunately, right now, it's very difficult to assess the burden in the countries where yet the AMR data is not covering the whole country. So it will be very much on the estimates. But already the countries that are able to generate the surveillance data, they can, even with this limitation that we have mentioned, I have also mentioned in my presentation, every country has its limitation. When it comes to data, it's not that comprehensive. It doesn't have the same representativeness for various reasons. Yet even with this data, we can already get the picture on the burden of the AMR. If the data can be expanded and improved, then of course the burden will also become more representative and more accurate. But yes, indeed, we don't have that for the AMR right now. However, there was a report published by ECDC early 2018, and I can also share this article with you that looked at the burden of the AMR in healthcare settings in European countries. And about 75% of the burden for the hospital-acquired infections was because of the resistant pathogens. So we have some estimates from the other parts of the region that can help us to conduct draw some conclusions.
Mm-hmm. Yeah, thank you very much. And maybe one more question from my side. When we talk about antimicrobial resistance, we often keep in mind bacteria and those surveillance networks that are that exist. Actually, they collect data on resistance among different bacteria, but resistance in fungal infections is emergent threat. And is there any plans to establish surveillance for the resistance in fungal infection and to assess the burden, and if this type of resistance actually now a threat, or it's not so prominent to consider it as a global threat, a global issue? Over.
Very good question, and I realized I have missed this update from the WHO headquarters, global protocol that has been developed to set up the surveillance of the Candida. And indeed, this is something that we have been looking into for quite some time. It has been somewhat neglected, and there is a protocol now available. And if the countries are interested, if there is a capacity and willingness, that WHO will definitely be supporting the countries to set up the Candida surveillance. And I think it indeed will be a very complementary surveillance aspect to the AMR.
Yeah, thank you very much. So I see that we don't have questions in the chat, so we will wrap up this webinar. And thank you one more time for very comprehensive and great presentation. Колеги, я хотів би ще раз подякувати вам за участь у вебінарі. Я бачу, що у нас немає питань у чаті, але якщо у вас будуть виникати питання, ви можете задавати їх у коментарях на Фейсбук-сторінці неурядової організації Medical Gate. Хотів би ще раз нагадати, що це був лише перший вебінар у третьому модулі курсу «Антибіотикорезистентність від знань до дії». І наступного тижня у нас буде презентація від колег зі Стенфордського університету, яка буде присвячена принципам раціонального використання антимікробних препаратів і впровадження програми з адміністрації протимікробних препаратів на рівні закладів охорони здоров'я. Тому долучайтеся наступного тижня у цій самій годині. Реєстрація буде відкрита також на Фейсбук-сторінці неурядової організації Medical Gate. На цьому я хотів би ще раз подякувати Кеті за доповідь нашим перекладачам і вам за ваш інтерес. І до нових зустрічей. Дякуємо.
Thank you very much. Thank you. Have a nice evening.